So it was a very unique study that we were inspired by lots of risk factor and association with cancer, and recent former US Surgeon General who sent out a guidelines advocating and guiding and creating awareness about alcohol and cancer association. So based on that, we looked into global burden of disease database, and we wanted to analyze how is mortality impacting based on the alcohol associated cancer. So using the database itself, there were around 8 cancers which we were able to look into it. And over past 3 decades, the number of alcohol associated cancer deaths have doubled, which means alcohol leading to cancer, and those cancers mortality has doubled almost from 12,000 to like 23,000 plus, which is quite concerning. When we looked into absolute rates for most of the cancers, we also stratified based on age and sex. And again, for most of the age and sex group, it was variating, but increasing in the recent years for many of those groups as well. The most impactful thing that we found was when we looked into proportional mortality rate, which means alcohol as a proportional of risk factor leading to this cancer deaths. As a risk factor, it has increased for almost all age groups, all sex groups, except just maybe liver for elderly people. But that is quite concerning, which means alcohol's impact on cancer is constantly increasing over past 3 decades in the United States.